So in this video, now let us discuss about the various malorimetric measures. Malorimetric measures are the measures we use for the measurement of malaria in a community. Okay, the malorimetric measures that were used in the pre-eradication era, and the eradication era are different. Okay, in the pre-eradication era, the malaria was mainly measured from the clinically diagnosed cases. Okay, in the pre-eradication era, three classical malorimetric measures were used. They were SAP. That means S for spleen rate, A for average enlarged spleen, and P for parasite rate, Okay. In a control program, the case detection machinery is weak. Therefore, the classical malorimetric measures may provide the needed information. These classical malorimetric measures may provide a needed information that they mainly provide the information about the trend of disease. Okay. What is the trend of malaria in a community? Okay. Now let us discuss each of them. First is the spleen rate. Spleen rate means the percentage of children 2 to 10 years of age showing enlargement of spleen. So in spleen rate we measure the percentage of children of 2 to 10 years age showing the enlargement of spleen. We have already discussed in the endemicity that two factors are used for the determination of endemicity. Okay, one is the spleen rate in the children of 2 to 10 years of the age, and second is the microscopically detected parasitemia. Okay, so in the pre-eradication era, since the measurement was mainly from the clinically diagnosed case, so first is the spleen rate, and in spleen rate means the percent of children 2 to 10 years of age showing the enlargement of spleen. Okay, why the spleen rate is measured? Why not adults? Why the spleen rate is measured only of the children and not of the adults? Because in the adults are excluded from this spleen survey because causes other than the malaria operate in causing the spleen enlargement in them. Why not adults? Because in the adults the causes of splenomegaly are various. Okay, so we take only the children for the survey of the spleen. Okay, and this spleen rate will provide the information on the endemicity of malaria in a community. Okay, that means how much endemic the malaria is in a community. Okay, the spleen rate will provide the information on the endemicity of malaria in a community. So it is an index used for the measurement of endemicity of malaria in a community. Okay, second is the average enlarged spleen. Second is the average enlarged spleen. So it is a further refinement of the spleen rate. It is a further refinement of spleen rate. So as the name suggests, in this we measure the average spleen enlargement. enlargement. Okay. And third classical malorimetric index was P, that is parasite rate. Okay, parasite rate means the percentage of children 2 to 10 years of the age. This is also measured in the children 2 to 10 years of the age, showing the parasite in the blood film. This is the percentage of the children 2 to 10 years of the age, 2 to 10 years of age. Okay, showing parasites in the blood film, showing the parasite in the blood films. Okay, other indices that are used are parasite density index. Density means, parasite density means the average degree of parasitemia. That means average degree of parasitemia in a well-defined population. So we take a well-defined population. And we measure the amount of parasitemia in that population, and it becomes a parasite density. Index. Okay, in the parasite density index, only the positive slides are included in denominator. Only the positive sides are included in denominator. Okay, only the positive slides are included in the denominator. Fifth and very important is a infant parasite rate. Okay, infant parasite rate means it is the percentage of infants, that is the age less than 1 year, showing the parasite in the blood film. Okay, infant means less than 1 year, and parasite rate means showing the parasite in the blood film. So it is the percentage of infants of less than 1 year showing the parasite in the blood film. It is a very important index. Why? And it is the most sensitive index. It is the most sensitive index of recent malaria transmission in the community. Infant parasite rate is the most sensitive index of recent malaria transmission in a community. Why? Because if the malaria is present in the infant, that is less than 1 year, it shows that the malaria has recently been transmitted to the baby. Okay, if a malaria is present in the adult film, in the blood film of an adult, it may suggest that the malaria was transmitted recently, or it may have been transmitted years ago. Okay, but in the infants, it indicates that the malaria has recently transmitted. So it is the most sensitive index of recent malaria transmission in the community. Okay, and if the infant parasite rate okay, is equal to 0 for 3 consecutive years, okay, it simply suggests that there has been no transmission in the transmission of malaria. Okay, what it suggests? It suggests that there has been no transmission of malaria, so it is regarded as absence of malaria transmission. Even though this point is important, even though anopheline mosquitoes may be present. Okay, even though the anopheline mosquito may be present, but there has been no transmission of malaria in the community. Okay, so if the infant parasite rate is 0 for 3 consecutive years, it is regarded as the absence of malaria transmission, even though the Anopheles mosquito may be present. Okay, and proportional case rate. Proportional case rate means, it is the number of clinical malaria cases diagnosed per 100 patients attending hospitals and dispensaries. So it simply means that if 100 patients attended the hospital, then among them, how many of them had malaria? Clinical malaria. How many of them had clinical malaria? So it is just a crude rate. Okay, just a crude rate. So these are the indices which are used in the pre-eradication era. Okay. Now we will discuss about the indices which are used in the eradication era. So in the pre-eradication era, the endemicity was mainly defined from the clinically diagnosed case, whereas in the eradication era, microscopic diagnosis of malaria cases became main method of diagnosis. Okay, in the pre-eradication era, the main method was clinically diagnosed cases, whereas in the eradication era, it is a microscopically diagnosed case. Okay, so what are the indices used in the eradication era? First and the most important is annual parasite incidence. Okay, note, it is not index, it is incidence. It is not index, it is incidence, API. It is incidence, annual parasite incidence, API. Okay, it denotes, what does annual parasite incidence denote? It denotes the incidence. In a community. What is the incidence of malaria in a community? Okay, what is the incidence of malaria in a community? And if the API, that is annual parasite incidence, is greater or equal to 2 per thousand population, then it denotes that there is high risks of malaria in that community. So annual parasite incidence denotes the incidence of malaria in a community, and if the API is greater or equal to 2 per thousand, then that area is a high risk area for the malaria. Okay, so annual parasite incidence means confirmed cases during 1 year by population under surveillance in 2000. That means the ratio of confirmed cases to the population under surveillance in a 1 year is a annual means 1 year, annual parasite incidence, and it is an index of incidence in the community. Okay, second factor we use is the ABER. ABER means annual blood examination rate. So as the name suggests, it is annual, means yearly. Blood examination means slide examination. So it is the number of slides examined in a population, okay. This is the annual blood examination rate, okay, and it is an index of operational efficacy. It is an index of operational efficiency. Sorry, it is an index of operational efficiency. So annual parasite incidence is a denotes the incidence in the community, whereas the annual blood examination rate denotes the operational efficiency in our community. Third is the annual falciparum incidence, okay. Since the falciparum malaria is increasing, so it is sometimes counted separately. So annual falciparum incidence is used for Plasmodium falciparum measurement in a year separately. Then we have slight positivity rate and slight falciparum rate. Slight positivity rate and slight falciparum rate. Slight positivity rate means the percentage of slide found positive for malaria. It is a percentage of slides found positive for malaria, okay, irrespective of the species. It can be of any species of Plasmodium irrespective of species. The percentage of slides found positive for malaria irrespective of the species, okay, it can be of any species. Whereas slight falciparum rate means it is a percentage of slides found positive for falciparum malaria. So slight positivity rate means it is the percent of slides found positive for the malaria. It can be of any species. Whereas slight falciparum rate means it is the percent of slides found positive for falciparum malaria. These two denote the trend of malaria transmission. Okay. Now we will discuss some of the vector indices. We'll discuss some of the vector indices in the next video, okay. Thank you.